please do use, there you go, as I said, please do use the chat to introduce yourself to fellow participants. It's great to know who's here because this is an event where we haven't quite got time for everyone to introduce themselves out loud. If you would use the chat to say who you are, what council you're from, and that's great just so that we know who's here and you know who's on the call with you. And you can even make some connections while you're here, because that's the magic of these events. There will also be a little bit of time for question and answers. So again, if you've got any questions for our speakers or any questions about the network, any ideas about the network, share them on the chat now, and we can include those in the question and answer session. Any questions we don't get to answer while we are here with you, we will do so afterwards. So hopefully there won't be anything that's left unanswered. I think that's pretty much it, by the way, of introduction. So with thanks to my colleague Hannah, we're sharing some slides now, and I'm just going to take you through a bit of the background to the Council's network, what we're doing, and how hopefully you can find this relevant to you. And thank you to my good colleague Callum for putting a message in the chat there to get us started. So I've said a bit about Centre for Mental Health. We are passionate about mental health equality. We're independent, and so the work we do is informed by good quality evidence and our understanding of what makes a difference in terms of reducing inequalities in mental health. And we're interested in that all the way through from prevention across entire communities and indeed the country, right the way through to support for people living with mental illness. We do also do a great deal of work with local and regional authorities. We finished last year a really exciting piece of work in the West Midlands, looking at how to improve mental health and wellbeing across the region there. We would bite your hands off if you said, come and do the same for the East Mids. Next slide, please. So just an example of some of the work we do. We know that our mental health is something which is created socially and economically, and this is really important to the Council's network, as you will see. But just to help with some of the kind of basics of what this is all about, we know that our mental health is determined by protective factors, which are things that are good for your mental health, that can help to create good mental health throughout life, and risk factors, which of course are the flip side, things that can do harm to your mental health throughout life. And the role of any council, no matter where you are, what part of the country you're in, what your population looks like, is to boost as many of the protective factors as you can for as many people as you can, as equitably as you can, and reduce the risk factors. Next slide, please. So very often when we talk about mental health, and particularly when we talk about it as a policy issue, people immediately think of the NHS, and we love the NHS very much. But we know local councils are fundamental to good mental health and wellbeing, and the more evidence we collect, the more work we do to understand what creates good mental health, what harms mental health, and what gives people with mental illness a good chance in life. All these things that councils do and are involved in are fundamental to that purpose. So look at all the things you as councils can do to create good mental health and wellbeing in your area and create more equal societies for people living with mental illness. Next slide, please. So we've also been looking at what councils can do specifically. I think we're about the only mental health charity that produces a manifesto for the local elections. We've done a couple for both last year and the year before. And we're very proud of that, that actually we have I think a deep understanding from talking to people working in councils about what that means to them and the things that you can do. And as I'll say later, we're also starting to think about how we can build up our knowledge even further. But we've now been working with councils for a decade in a number of different ways. Last year, we revived our work to create this new Mentally Healthier Councils network. And this event is one of 9 in each of the regions of England to launch that and to come alongside you as champions in your area. Next slide, please. We're very, very lucky that the Health Foundation, another national charity, has supported us to do this work. Their support has allowed us to put this event together, and indeed all the others and all the other things you'll get. It's free to join, so there's no charge to be part of this network. We've got 300 members so far. My colleagues have rather ambitiously said we'll get 1,000 here. I think we will. So please, after this, join up and encourage your fellow officers and members to sign up as well. Everyone working in local government or who's an elected member of a local council at any level, whether that's parish, district, county, borough, you can all join. And we hope that you'll do, because the more people we got in this community, the more exciting ideas we will develop. We have got a national event coming up in July, and we'd love to know about what you're doing locally to support better mental health in your area. And maybe that's something we could feature in one of our communications that we produce from this group in the near future. Next slide, please. So what can you do for us, and what can we do for you? Well, please do promote the network, encourage everyone you know to sign up. Anything you think that we would find interesting, please share it with us. And please know that we can help you too. So whether you're working on a mental health needs assessment, whether you're trying to understand the mental health needs of your area, whether you're looking at particular policies and how they might benefit people's mental health and well-being, use us as a resource. We're here for you. As part of the council's network, we're here to support you to do what you want and need to do to create better mental health in your area. Next slide, please. That may even be it. And please do tell us about what you're doing that makes a difference. And I think that's all from my slides. What a relief that there are no more slides to share. So now we can see one another. And I can see our lovely speakers who are all here. While speakers are speaking, you may want to have your cameras off, but you're welcome to have them on. That's absolutely fine. Sometimes it's a bit weird when you're speaking to a black screen. So do put your cameras on if you would like to, but don't feel that you have to. It's not a requirement. Okay, so believe it or not, we are slightly ahead of time. Who knew that could even happen? But good for us. And I'm now really delighted to welcome our three brilliant speakers. First up, we'll hear from Councillor Sarah Russell, who is the Deputy Mayor of the City of Leicester and I think portfolio holder for health and social care. So that must be quite busy. We're also going to hear from Melanie Williams, who's the Corporate Director for Adult Social Care and Health in Nottingham and Nottinghamshire. And we're going to hear from Mark Hudson, who's from the Derbyshire Mental Health Support Mapping Coordinator from our friends at Rethink Mental Illness. So we've got three fantastic speakers who are going to share real life experience and knowledge. But I know everyone on this call will have real life experience and knowledge too. And so we will want to hear from you, and we'll look forward to all the things that you're able to share with us and one another over the course of the next hour. The only other thing to tell you is I will make sure we finish on time. So come what may, we will let you go by 2 o'clock. We know your time is precious, and we really appreciate that you're spending that with us today. So I'm going to hand over first to Sarah. Sarah, you are incredibly welcome. Thank you for being here with us today.
No, thank you very much. I've got a couple of apologies first off. I'm doing this on my phone alongside my council role. I'm a parliamentary agent and things are a little bit chaotic, but I've realised, having joined on my phone, that having dropped it in the garden last week, if my picture is slightly distorted, it's because I've cracked the phone screen and probably around the camera. So I apologise straight away for that. I don't usually look quite so distorted, but never mind. Thank you ever so much for inviting me to speak today. It's great to be here as part of this launch. So my role currently is Deputy City Mayor for our elected City Mayor in Leicester. And my role encompasses children's and adult social care, public health, health integration and community safety, alongside anti-poverty, which I have held on to because it's a passion of mine. So I've got a fairly broad role which enables me to really get involved in a whole range of different ways around mental health. Until fairly recently, one of my colleagues had chosen to maintain the mental health champion role because, again, she's incredibly passionate about it. And what I'm really proud of in Leicester is that it isn't just something that falls to one person. It's something we talk about openly and regularly in a whole range of different forums, and are fierce about mental health being considered on a par with physical health, and recognition from right across our strategies as to how it interweaves and the impact it can have positively and negatively across all of those. So I'm going to try and go through a few of the things that I've been directly involved with in the tackling inequalities in mental health, and how we try and focus in on particular areas, and some of the difference we're starting to see. And it is only starting to see. It always feels like this is a huge, huge challenge for us, and something we can never take our eye off the ball with. So I suppose the first thing is looking at that protective factors from as early as possible. The work we've been doing across not only schools, but actually in nursery settings and earlier, looking at how do we build resilience across our young people? How do we try and counteract what is an education system that creates a level of stress for people, which I think is just growing year on year. The pressures on schools gets transferred across to young people. I say that as somebody whose 18-year-old is sitting the last of her A-levels exams today, and who the stress of which has led to her being medicated. You know, it is that level of the impact it has on people is absolutely horrendous and wrong. And the more we can do to build up that resilience in our young people, the better it can be. A nice example of what I mean by that is the school I'm a chair of governors at had its Ofsted a few weeks ago. We've been doing a lot of work. We've got 3 to 7-year-olds in our infant school. We've been doing a lot of work around building their resilience, building their sense of self, their sense of their willingness to try, and their recognition that failing at something isn't a failure of them. It's a part of the learning process, and getting that in as early as possible with them. And we had something which warmed my heart, I'll be honest. It was one of the children said to the inspector, sometimes I take myself off from Cllr in class when people are doing something else, because I need a few minutes to clear my head, and my teacher understands that, and then I'm comfortable to go and join in again. And the fact that a 5-year-old had understood that that's what made the difference to her mental health, to her being able to participate, and how to manage that and how to communicate it to someone, gave me real hope for a generation of children who I think we are starting to have a really, really positive impact on. I think there's probably a middle gap, those who are in secondary school and above now, who we maybe not have got to early enough for. And I think we've got a huge challenge to support and to make sure we offer as much as possible for. But I do think that work in the early years is starting to show dividends, and I hope it's something we can continue to really put a huge emphasis on. We've had a massive expansion around early intervention across our adolescent mental health. I will say I think it's been really important that range of offers is there. We are not yet seeing the reduction in people needing the sort of critical mental health services that I'm hoping we will see over time. And I think it's how we understand what services are being offered, how long it takes for them to have an impact, that actually a 6-week programme is very rarely enough to help a teenager turn things around, that people need longevity, they need things in their community, and building up these skills to make you more resilient it takes time, it takes energy, and it has to be got at the right time. So I think we're on a journey with that. It's going in the right direction, but it's still getting there. But the bits I really wanted to focus in on today is some of the work we've been doing to understand the mental health of our adult population. And we look at it in a range of different ways. One of the things that we've tried to look at is, and we do a lot of survey work in Leicester to try and understand our population. We've looked at loneliness, we've looked at people's own understanding of their mental health. But the other thing we've tried to start to understand is resilience and the impact that can have around mental health. So across both our children's and our adults' health and wellbeing surveys, we've been asking questions for the last 6 or 7 years now around whether people have somebody they can rely on. And it sounds straightforward, but for children, that's a trusted adult they can go to if something goes wrong. It doesn't have to be a parent. It can be anybody in their life that they've got somebody trusted. But for adults, we've broken it down a bit more. we've said, if you had a bill you couldn't pay and needed to borrow £50, have you got somebody you can go to? If you needed to get to a medical appointment and didn't have transport, have you got somebody you could ask? If you were worried about something, have you got somebody you could turn to? The answers to those questions and the way we've collected that data have really raised very, very significant concerns about the resilience of our population in the city. We've got far too many people who haven't got any networks that they can turn to. And whilst they may currently be saying that their mental health is fairly resilient, the reality is that if something goes wrong, without those trusted people around them, without those networks, it means that people's vulnerability is so much higher. So one of the things we're trying to do, and I'm really keen that we do get the opportunity to work with other councils, with the Centre for Mental Health, is to think about how do we help people build up those networks? How do we not only reduce loneliness and give people those social connections, but make them social connections that people can trust in, can rely on, can develop over time? Because it can't be just around us getting additional services in place. It has to be around how do we help significant population change. Having said that, there are services I think we can put in place, particularly around reducing inequalities. And I just wanted to cover briefly one that we've worked with specifically with food banks in the city. So we've got a horribly high number of food banks operating in the city, ranging from those that just do emergency food provision through to social supermarkets and everything on the ladder between. What we found is right from the outset that people were very clear that that it was a chicken and egg situation. Some people's mental health was impacted because of high levels of debt, food insecurity, and a range of other things. And sometimes people's mental health had led them to have higher levels of debt, food insecurity. And actually, it didn't matter which way round it was. Inevitably, we had people accessing emergency food provision who had mental health challenges, and we wanted to be able to support them. So we've worked across the voluntary and statutory sectors to get people in the front line, working directly with people who are accessing emergency food provision and who need to access wider advice. And we've found by putting in that provision and the additional support, not only have we got been able to support people into earlier access for mental health support than they would have done to start with, we're finding that people who are struggling with their mental health are able to access advice around debt and welfare benefits and a range of other things in a way they hadn't done previously. So our community advice and law service, for example, is reporting a 31% reduction in dropout rates of people who have got mental health challenges, who need to access support around debt and welfare advice. Previously, people had really, really struggled to continue to access the service, attending appointments, organising information, a whole range of things which just was beyond where people were at in that point in their lives. By having the mental health support going in first and people sitting alongside someone, what we've found is people have been able to access that support, been able to increase their income, been able to reduce that stress, and therefore has had an overall benefit on their mental health alongside the treatment and support they've accessed. So I'm going to stop, but it is really a multi-pronged approach. I think one of the things we struggle with actually is to capture the sheer number of things we do as local authorities that are about tackling, supporting and really developing that resilience for people. But there's lots happening and it's very exciting and it's great to be here today. So thank you.
Thank you so much, Sarah. That's just wonderful to hear about. Leicester was one of the very first councils in England to have a mental health member champion, and the fact that you still do 10 years on is fantastic. So thank you for what you're doing. I think the work you've just described will be one of those things that we could really inspire people with across the country to see the potential as shocking as it is, there's the number of people that are currently relying on food banks. The way you've reached out and sought to change people's circumstances to improve their mental health is truly outstanding. And we can certainly help and link you up with other people working on community assets and that kind of meaningful social connection and connectedness that we know is so important to mental health. It's a bit of a cliche. We always say that mental health's made in communities, but mental health is made in communities. And that, of course, is so important. Sometimes the cliche is just the truth wrapped up in a fancy phrase. So thank you so much, Sarah. I'm now really pleased to ask Mel to speak, Melanie Williams. The last time we were at the same event.
I'm just mute.
Oh, sorry,
Sorry,
I think I got muted.
I clicked on something there, Andy, and muted myself as well. I don't know what I did, so apologies. I think that might have been me.
There's always got to be one technical thing per Zoom meeting. It is actually compulsory. We've now been through it and we've got past the other end of it. Yeah. Melanie, thank you so much for being here today. It's great to have you here, and over to you.
Okay, hi everybody. So I'm Mel Williams, and as Andy described, I'm currently Corporate Director in Nottinghamshire, so I lead on adult social care and public health. But I'm also President of ADAS, and for several years I've worked nationally as a social care mental health policy lead. And I'm really passionate about mental health, so I'm really pleased to be joining today. So I'm going to really cover off, I think, building on some of the reflections of Sarah, really why mental health of our people is council business. I'm going to touch upon what we can do as councils and councillors to promote social wellbeing. And I'm going to share some practical examples of particularly of how members and leaders in local government can consider mental health in what they do. So mental health is a key aspect of human well-being, and it's a vital component of social and economic development. And we know, don't we, that as Sarah's described, many of those ways in which poor mental health affects our ability to work, to learn, communicate, participate in life. But it can also be a health inequality in itself. So having a mental health problem increases our risk of physical illness, substance misuse, violence, and poverty. And most of us have had lived experience of poor mental health at some point, either directly ourselves or through support to a family member or friend. And many of us will know somebody who's experienced very significant mental health distress. So I guess I don't really need to make the case to this audience about, some of the drivers of why it's important. But what I really want to emphasise is that crucials have a crucial role in promoting and protecting mental health of our residents and of our staff. I think it's really important to think about the colleagues that we have in councils and that we employ directly and indirectly a huge workforce across our areas. We're also responsible for providing commissioning services that support people's mental health directly and indirectly. And one of the key ways that we can, as leaders and governors of our services, include mental health in the thinking of all of those services. So whether we're thinking about housing, education, social care, leisure, public health, or the indirect things we do around economic development, income development, environment, there's a case, I think, for having a mental health in all policies approach where we consider how those activities improve mental and emotional well-being. So we know by investing in mental health, we can improve the quality of life of our communities. And that in turn will start to, please those of you that are really concerned about the demand and pressure on services that Sarah described, because when we're investing in mental health, we know that people are better off and then don't need the more intensive services of the NHS that Andy described in his opening bit. So some of the things that we can do would be around developing and implementing specific strategies, and it's really good to hear some of those examples from Sarah. So there are those things that we'll do like mental health strategy, suicide prevention strategy, but it's also important to think about the different populations within that. Certainly one of the key roles that we have to play is about engaging with people with lived experience and their carers and promoting that voice. So we're making sure that what we're doing is co-produced and it's delivering impact for our residents, because that's really important. And we can also continue to think about the integration of services. So think about how our health scrutiny function, for example, really focusing on integration of services alongside calling the NHS to account for its quality standards. So let me give you a few examples in Nottinghamshire of how we've used some of those functions to do that. So health scrutiny in Nottinghamshire has had a real keen interest in mental health. not least because our mental health trust is under special measures and under Section 48 and Secretary of State review, but because members have seen the importance of mental health to our residents for some time. So what I've tried to do is support our health scrutiny to consider much more than an improvement plan that's been overseen by NHS England, and starting to think about how can we really relate what is a sort of somewhat divorced approach from people and communities to very much about listening to people and getting drawn into real issues. So rather than us having a look at a traditional method of scrutiny where we call people into account to give examples of what they're doing, we're looking at trying to chunk the work on issues that impact on people's lives. So we're looking at examples of the experience of people experienced in crisis. We're looking, for example, about how we're supporting the mental health for children and young people. We're looking at how we're supporting mental health closer to home. So rather than thinking about things in organisational terms and services, we're trying to have a focus on lives. I think that has really engaged our health scrutiny members in a way that I think is much more creative and imaginative. One important contribution that councils can make is to lead for making mental health everybody's business and making it a part of all policy and work, as I described in my introduction. So let me tell you a little bit about how we've tried to do that for suicide prevention and how we work to do that. So suicide prevention strategy is a public health leadership function, so it's part of that portfolio. But what we've tried to do is to make that a much broader whole council and indeed sort of wider system approach to that work. So we lead the work from Health and Wellbeing Board, but certainly we sit as something that sits outside of the council, but with our strong leadership and with political leadership. So we started to make sure we engage a consultant and hear many voices. So that bit about being really close to the experiences of people, listening to their lived experience and their family, and particularly when it comes to suicide prevention, bereaved families, to understand about what we can do to make a difference. So what hasn't worked, what's worked well. We make sure that we model this idea about suicide being everybody's business, but also that we lead that conversation in a way that's empowering, is mindful, and change the narrative of suicide. So every discussion we have about our strategy will also start with some very simple training messages and communication messages about how to use the correct language, how to talk to people, and particularly signpost colleagues to training and mental health first aid. So we see every opportunity to engage are also about raising awareness and making that sort of making every contact count approach. We share stories, so we try to talk about our strategies by sharing the stories of people who've lived experience. So we use videos and other forms of sort of sharing those messages to make it feel very alive and very real to our residents. We sort of staged a very early session at our select committee, so we used the Public Health and Adult Social Care Select Committee to get that sort of scrutiny focus at every stage in the development, and equally to make the most of that messaging about suicide prevention. So we kind of used it with dual purpose to make sure we had that check and challenge about whether we're co-producing, listening, engaging, and on the right track, as well as making the most of sharing key messages. And particularly for that, we considered our role as an employer alongside being a leader in public health. So we have made sure that we were tackling how we're supporting our workforce, how we're progressing workforce wellbeing, and how we're rolling out mental health first aids. We sort of saw that as a dual role, which is really important. So I know at times it can be really hard, can't it, working out what we control and what we don't control. So Sarah and Andy both touched on this in their introductions. Mental health is a community issue, and often though we see mental health through the lens of a service. So immediately we start talking about mental health, people start talking about treatment or diagnosis or medication, think about the NHS and services rather than lives, and that can be so difficult. And we know that the systems around adults and children are hugely complicated. We get tied up thinking about what's prevention, what's education, what's early health, what's the role of schools. So I think that the tip I would share for that is just about starting to explore it and asking for explanations. So to give you a practical example of how we did that, so we had a special select committee focus on mental health earlier in the year. and it was really examining the role of the council. So the idea wasn't necessarily to scrutinise and develop a strategy. It was much more about understanding about what our role was and whether we could extend it. So it's a very practical style of scrutiny. So we heard from our people. So that included our staff, public health, social care, those that kind of had a specialist role, as well as those that had a broader role. And we particularly focused on what we do, what's the impact, and what we can learn. What members found really powerful was hearing the stories from people. So, for example, our approved Mental Health Act professionals that are involved in the detention of people when crisis is really quite problematic, they were sharing their stories about a day in the life of an AMP. And that was really powerful in terms of, I suppose, amplifying what is a very niche area of mental health supporting councils in a very simple way. And so this sort of kind of helped us start to understand, well, what's the role of the council? What's the role of leadership? What's the role of governance? What's the service offer? And it enabled members to gain much more confidence in their ability to scrutinise, challenge and support as we go along the way. And it particularly helped us promote and understand mental health and mental health services. So like I said, that's one of my key tips really, is feeling confident to ask those explanations. And then I think the thing that I think is really helpful is to always have a focus in the Health and Wellbeing Board on the role of mental health and wellbeing in every agenda item. So really making sure that bit about health in all policies is modelled by the Health and Wellbeing Board, and using that as a central function of the council to tackle those issues. So hopefully, Andy, that's given colleagues a bit of a flavour of why I think it's important that this network is here, because I think it's amazing to have this resource to share examples, whether it's a detailed projects that Sarah's described, or if it's about the broader role of members can have, and then also just giving a few of those practical tips. So hopefully that's useful to the audience.
I found it incredibly useful, and Mel, thank you so much. It's brilliant that you're president of ADAS, by the way. That couldn't be better. And I think what you've shared is so important. We know councils are really struggling financially at the moment, but many of the things you're doing are not things that cost money. They're things that are about spending the money you have well, and thinking deliberately and specifically about how you can use that power you've got, that influence you've got as a council to in the best possible way for people and making good decisions. So it's truly inspiring. Thank you for that.
No, thank you, Andy. And I do need to go a few minutes before the end, but really happy if anybody wants to ask some questions in the chat. I'm really happy to do that in the time before I've got to go.
Great. And I know Sarah also has to leave in good time as well. So if anyone does have any questions they want to put in the chat for Mel or Sarah, please do. And any questions we can't get to now, we will answer later, or we will pass on to Mel and Sarah in good time. Okay, I'm really pleased now to invite Mark to join us. Mark, who works at Rethink Mental Illness, one of our great friends, and I think you're going to share some really exciting work, which I think very much links up with what we've heard so far about mapping community assets. So over to you.
Good afternoon. Thank you, Andy, and thank you for inviting me today and sharing the project that we're doing here in Chesterfield. So as you've heard, my name is Mark Hudson. I work for the Derbyshire Recovery and Peer Support Service. And what I'm going to do is try and share my screen now, just to see if we can just highlight a few things. Slowly working. I don't know if you can see anything yet.
It's there. It's all good. It's brilliant. It's worked perfectly.
It's all good. That's brilliant. Thank you. So this is who I work for under the Rethink umbrella, the Derbyshire Recovery and Peer Support Service. That's how you get in touch. That's when we're available. That's how to refer in. That's what we do. So we offer one-to-one support, self-help and peer support, telephone support, advice and information on mental health, recovery education, social activities in the local community, and signposting. Single point of access. You can sign in yourself, or you can be supported to do so. On our website, there's other ways to get in touch and find out all about us as well. But the main thing I'm here to talk about, and the reason I've been invited today, is to talk about the mental health support map project that we are working on in Derbyshire. And hopefully you can now see that on your screen. My role is to grow peer-led mental health support groups around the county. And I've been doing that for this service for the last 8 years. I think I'm in my 8th year now. And one of the projects under that is this map. As you can see, the map aims are to bring all aspects of mental health and wellbeing together in one place. And we do this in 10 layers via this Google My Maps. It's free. There's no cost to this apart from my time. And I do it within a very busy role. I see it more as a labor of love. It's got no money. It gets no money. It gets my time. It gets my attention. And it gets a lot of views as well. A lot of people view this. It gets 8,000 views a month here in Derbyshire. So that's quite amazing. It's set out in 10 layers. You know, crisis support at the top, bereavement, mental health support and wellbeing sessions. That's an additional thing that we offer as a service above and beyond the groups and the one-to-one support. And there are opportunities for people just to call in, ask a question about mental health, be heard, feel supported, and find some signposting or information that would benefit them. This is my role, peer support groups. I grow these and have been doing so for many years around the county. So the list goes on. It's quite a long list, actually. I'm going to bring it up for now, but because I want to show the other layers, which include ethnic minority support services, young person support services, nature, outdoor and activity support services, which are all great LGBT support. I'm running out of layers now, so I've got ABC of support services. It certainly helps me, and I think it helps others as well. But and at the very bottom, we've got mental health and wellbeing sheets. All of this is trusted sites, all that's already out there, or something that we as a service have created. So and the map is very interactive. So in a medical emergency, simple message, you know, call 999, whether it's a mental health or physical health, and it's just putting those messages out there and letting people know the pathways to. And if you were supporting someone who is feeling suicidal, or you are feeling suicidal, you will find information on here. And if you click on them, they open up and more information can be seen, but I hope. So there you go. It's a mind, it's a trusted site. So it's nothing new, it's just bringing it all together. I can also upload posters, which I do, or in this case, subliminal messages that are already put out by the Samaritans. The other things will be pictures that Google have put on, but that's by the by. But I can upload up to 10. And to navigate your way back, you just keep pressing these buttons. And a great Stay Safe from Suicidal Thoughts is a great site. It has some great messaging on there and is a very supportive app, actually. Again, click on that. Testimonials, loads of support options on there, and well worth having on the map. Bereavement support, top on there, that is a list of all of the bereavement support helplines that I know is available. Growing all the time, of course, but it's not definitive, but it gets there. These are local. The Sunshine and Shade, a local bereavement support group. The Good Grief Trust, Sue Ryder, they're all on there. And the health and wellbeing drop-ins, these are very informal drop-ins for people to ask about mental health for the first time, or for the 100th time, or whatever time they can come in and just ask, no appointment needed. And this is my job. This is what I do. I set these groups up around all over the county. It's all listed in alphabetical area order. So I'm in Chesterfield today. That's where I'm based. That's where I live. And what happens is you click on that. It tells you a little bit about the group, contact details, a little bit more information down there. Again, the posters up there. So you can access that, and so on and so forth. So that's how that works. And one of the powers of the map is that it's shown to be a meaningful addition for people with mental health. It empowers them to seek support for themselves at a safe time, in a safe space for them. And it's 24/7. It's interactive, it's informative. The software is Google. It's a Google My Maps. It's kind of an extension of their maps. Anybody can have one, and as I've said, it's free to use, and the only cost is my time. No small task, that, by the way, but nevertheless, I do see it as a worthy project. And as you can see, it's informative and interactive. You can have up to 2,000 items on there over the 10 layers, and that's 10,000 entries. So it's no small piece of kit, to be honest. I suppose we should talk about access. It can be searched for online. Community Mental Health Support Map Derbyshire will easily find it. It can be searched for on your phone. You can also get to it by a QR code or a link that I'm happy to share in the chat after I finish today. So why we developed it is quite important. So it was a mapping exercise within the service. Initially, actually, to promote the good work that the peer support groups do around the county week in, week out, and highlight the good work that they do all of the time. But as you can see, the initial brief just extended to those additional layers, and the wealth of information and support on there, and the testimonials we'll get include comments like useful mapping tool for all, ease of access, everything in one space, gives a county-wide picture instantly, allows everyone to learn about mental health support quickly, potential to be a comprehensive listing, highlights support that is available over the bank holidays and out of hours. Future ideas, a chance to grow awareness of the map to help support more people, great volunteer opportunity, embed the map into more websites. It is on the Derby and Derbyshire Emotional website, actually. It is embedded on there, so you can easily access it from there if you would like to. It's on other websites as well. But the map has been proven to be a meaningful addition for people's individual health, empowering them to seek that support 24/7 independently. So that's me, I guess, Andy, and thank you.
Mark, that's fantastic. Thank you so much. I'm really inspired by that. And first of all, the immense power of knowing what's around and that huge role that local councils can play in ensuring that all the assets that are in their community are known, available, accessible, and you can connect people up with them. It's such an important role. And secondly, just the extraordinary range of community organisations that are there and the assets you have got. And that's one county. And across the region and across the country, there's a good deal more, and huge benefits to that. I think, Mark, you're still sharing your screen. If you wouldn't mind
I will try.
Yes, will take us back to the beginning. And
I do apologise.
No. You have nothing to apologise for. That was a super presentation. And James,
I have to work out how to unshare. Have I unshared?
You've done it. Yeah. It's all good.
Thank you.
We're all back together. Now we've got a short while for any comments, questions for us or any of the speakers who are still here. It would be lovely to see you. So if you wouldn't mind putting your cameras on, it would be lovely to see who's here. As much as I really just don't want to stare at my own face for a little while, and it's much nicer to see you. So does anyone have any questions, any reflections? Anything you want to know, anything you think, why haven't they talked about this yet? It would be great to hear anything you want to share with us. You don't have to. It obviously partly depends on how long you like periods of silence, or indeed listening to me trying to fill a silence. But of course, you don't have to have questions. It's not compulsory. There is no requirement. Oh, James.
Yeah, not so much questions really, but just a couple of comments. I think this has been a really useful session. I've taken something from each of the speakers. Really useful. And I think I'd look into the future, really value this network. So if we can work across the East Midlands to grow this network, to connect each other much better together. I'm sure we all have a lot of similarities working in local government, but there will be a lot of differences and a lot of pockets of best practice that we can share with each other. So like I said, I've already taken a couple of those things, which are going to be really useful for me. So thank you very much.
Thank you, James. That's amazing. And I know we're a relatively small group here today. We are a small group here today, but you all have lots of colleagues and partners. And please tell your friends about this. Encourage people to sign up and join. The more people, the thousands of people work for each local authority. So there's so much more potential to grow this network. You can be the seeds that began this and helped to create something truly magical. And let's get the East Midlands right on top of the country in terms of the number of people in their local councils that are part of this. That would be amazing. And of course, we can also link you up with one another too. There is a kind of hive mind thing to this, that all the answers are out there, great things are out there. Think of just the inspiring pieces we've already heard. So yeah, please do keep sharing this and share stuff with us. And I've learned a lot today just from sitting in on the fantastic conversations we've had. Does anyone else have anything they want to share? Any thoughts, feelings? Sarah?
Yeah, it's just a quick one. It's all right. I'm struggling with Wi-Fi and various other bits, so I'm going to leave my camera off. We've got the East Midlands councils in the East Midlands and have a range of different things that comes through that route, including some different lead member networks and other things. And I'm wondering if it would be possible to share some of your details through that East Midlands Council's newsletter and other things. I think that might be a quick way of getting it out to as many elected members as possible, but also across to officers as well. And we could maybe look at doing something at one of the Executive annual meetings around it too.
Sarah, we would love that. Thank you. That would be absolutely brilliant. And we'd be thrilled to connect with that network. And yeah, the more the better. So thank you very much for that. That's a definite yes.
Happy to help facilitate that. If somebody emails me after this, it will be after I get back from my holiday, but I will happily organise that.
We'll let you have a holiday and we will definitely follow that up. Okay, I think that unless anyone has anything they want to share quickly, in which case just shout at me or put your hand up. Don't mind how you do that, that's fine. I will just remind you that we have a national launch event on the 23rd of July. You can join that either in person or on a remote platform, probably this one. So please do join us for that. Details will be sent around to you. I do want to thank my colleagues, Hannah and Callum, who are here on the call, and Bethan and Ed, who are not, who have various appointments today, who couldn't be here and were very sad not to be. But thank you to all of you for putting this on today. Thank you to all of you who are here and who do champion mental health locally, whoever you are, however you do it. We're very grateful to you for it. It means a lot to us that you do this, and we know how hard it is in local government at the moment, how hard you work, what you're trying to do in really difficult circumstances. So we really are incredibly grateful, and it makes such a difference. So thank you for doing that. I hope you enjoy your afternoon. And thank you for being with us today for this launch event. There will be plenty more to come. So take care and thank you very much.